The PFS to brigatinib has ranged in clinical trials anywhere from about 12.9 to about 16 months. And that's post-progression on crizotinib. And cross-trial comparisons between ALK TKIs or any drug cross-trial comparison can often be difficult to firmly interpret. But in terms of numerical superiority, it does seem to be a little bit better than alectinib, which was about 10 months, as well as ceritinib, which was a little bit less than that. So I think that brigatinib did show numerically higher progression-free survival, but it is a cross-trial comparison where they're not necessarily the same population, so there can be some differences there. So you have to interpret with caution, but it certainly provides some justification for thinking about brigatinib in this type of case situation. In patients treated with brigatinib in the ALTA study, the Huber and colleagues' abstract looking at intracranial responses did show excellent activity, justifying the use of brigatinib in patients with asymptomatic brain metastases. The overall response rate in the CNS was about 67%, which is superb, with a median progression-free survival of 18.4 months in patients who received brigatinib at the FDA-approved dose of 90 milligrams for 1 week, followed by 180 milligrams daily. Brigatinib dosing, titration, and administration. Brigatinib is given initially at 90 milligrams once daily for 1 week, followed by 180 milligrams once daily thereafter, with or without food. And the reason it starts at a lower 90 milligram dose for the first week is because of early onset pulmonary events that were observed in about 9% of patients that occur on average between 2 and 3 days on brigatinib. When these events occur, brigatinib needs to be held until those symptoms resolve.